There are a lot of, I think, good tools out there to look at mental health with children and adolescents, but there are some gaps that exist that I think we should focus on. And I think one of the main things is much of what's out there, we're just looking at symptoms. We're looking at, does the child have a problem? And a lot of times people come into an appointment, we know that there's some type of a problem or a difficulty, and it's kind of what led them there. So I think the gap in the instruments really is kind of the utility. Do they help us create better interventions? Do they help us understand kids differently so that we can do better interventions? And really having, I think, a theoretical basis to the instrument. So a lot of instruments, they're just based on what symptoms are out there. But we have a lot of good theories that help us understand interventions. And in my world, that's cognitive behavior therapy. So, having a theory that drives the instrument then lets us have a kind of I think, a better path to more evidence-based interventions. So those are gaps, I think, that exist that, we're oftentimes just focusing on diagnosis, but the real question is, what do we do? And that's the gap where I think we could do better in assessing in general. Cognitive behavioral therapy has been around for a while. Basically, cognitive behavioral therapy is this idea of how do our thoughts, our feelings, and our behaviors interact with each other. But we kind of take that a little further, and I think it's not just that. It's how do those things work together within an individual's social world. So we can't forget we also have relationships and connections and environments that we're in. So we also have to consider how do those factors impact and interact with that idea of thoughts, feelings, and behaviors. So cognitive behavior therapy is how do we understand those variables and then determine where within those thoughts, feelings, and behaviors do we intervene to have better outcomes for kids. Yeah, I mean, school-based mental health has grown drastically over the last 25 years. And I think post-COVID, we're absolutely seeing more and more need out there. And that's also resulting in schools taking on some of that burden. There aren't providers, out in outpatient facilities. So I think the movement in school-based mental health is twofold. One is, what can we do to help prevent mental health issues for children? So are there skills that we could teach everyone at an early age that will help protect them from having difficulties later? So things like relaxation or mindfulness, or how do we just organize ourselves in a way that we're not under so much stress? Those may be some good protective things that we can do early with kids. And then once we realize there are some kids that even with that are still going to have difficulties, really focusing on what are good evidence-based interventions. So it's not just about, let's put kids together as a group. We know enough information about when that group's together, what can we do to target it in an effective and efficient way so that kids will kind of unlock better outcomes for kids. And so I think focusing on really what we know from the science that's out there and putting together programs that will really focus on meeting those needs, I think that's really the trend. And it has been the trend for a few years. We just continue to get better at it. I think the other piece of it is, for years, we've thought about mental health treatment as being, you have anxiety, we have a treatment for anxiety. You have depression, we have a treatment for depression. And what science is showing us now is this idea of what's called transdiagnostic approaches, which means that the same skill that we can work on with someone with anxiety will also help decrease symptoms of depression. So we're no longer saying we're going to treat just this thing. It's more about a mindset of what are the skill sets, or in psychology we say the modules that we're going to work with kids to be able to give them the best outcome, no matter what the diagnosis is. So while diagnosis might be important, we have a knowledge of this idea of what runs across diagnoses that can be helpful in treatment. So I think since I've started in the field of psychology, mental health has changed, and I think for a few different reasons. I think early in my career we focused solely on the most severe situations that were occurring. So we were helping kids when the problems were, at a point where they were getting suspended from school or they were needing a special service. And I think over time, as far as a service, mental health has changed, that we're being more preventative. We're trying to teach skills early on. We're not reacting to when someone has a problem. We're trying to be a little bit more thoughtful on that front end. But I think also with that, the world's changed in the time since I've been in school. And, so we have kids who aren't sleeping well at night because they're up doing homework till 1 o'clock in the morning and then getting up at 6 for school. I'm not sure that's a mental health problem, but there's a consequence of mental health if we don't address it. So those are the things that I think we're changing. We're understanding that piece of it better and not just looking at just purely mental health. There's a lifestyle that's created higher anxiety. We have media and device use. We have those types of things that all kind of contribute. So I think as a whole, the mental health field's understanding that better. And so we're addressing it a little different.